cardiac arrest. And what is the difference? So one is an electrical problem and the other is a circulation problem. Just a brief definition of cardiac arrest. It is a sudden and life-threatening event where the heart stops working as it should. And you might ask, how does that happen? And why is immediate action critical? Well, a proper definition would be cardiac arrest is the sudden loss of all heart activity, often caused by a disruption in the heart's electrical system. This disruption can result from a heart attack, from trauma, or other conditions affecting the heart. Under normal conditions, the heart pumps blood around the body in a coordinated rhythm. The heart has 4 chambers, and the 2 upper chambers, called the atria, receive blood from the lungs and the rest of the body. And then they then pump that blood down to the bottom chambers, called the ventricles. The ventricles are larger and more powerful than the atria. They pump blood out of the entire body and the lungs. As long as the ventricles pump all the blood the body needs, the body stays happy and healthy. Sometimes, however, the ventricles just stop pumping entirely. And this abnormal heart rhythm is what is called a systole. Here I'm going to only restrict myself to three abnormal heart rhythms. And so I've already mentioned the systole. And what it basically means is the heart has no electrical activity at all, leading to a halt in function. Another type of cardiac arrest occurs when the heart's electrical activity becomes chaotic and the ventricles start quivering or fibrillating or shaking really, really fast instead of pumping. This is an abnormal heart rhythm that is called ventricular fibrillation, just like I mentioned with quivering and fibrillating. Often, ventricular fibrillation will begin with the ventricles suddenly pumping very fast, about 2 or 4 times faster than normal. And this abnormal heart rhythm is called ventricular tachycardia. At this stage, blood is circulating, yes, but if the ventricular tachycardia is not managed, it will progress to ventricular fibrillation and the heart can no longer pump effectively. When the heart stops pumping for more than several minutes, the lack of blood flow leads to tissue death. Fortunately, with immediate medical intervention, such as CPR, which we're going to learn today, and defibrillation, which is shocking the heart's rhythm can sometimes be restored. A person in cardiac arrest will become they'll become unresponsive. They will also stop breathing, or they'll have abnormal breathing. You might notice gasps or occasional breaths taken after a few seconds. That is abnormal breathing. And also they will not have a pulse. So how do we check your heart's rhythm and electrical activity? We use what's called an ECG, or if you subscribe to American English, an EKG, full name electrocardiogram. And this is a test that will check your heart's rhythm and electrical activity. It works by sticking electrodes on your chest. I know some of you can relate because you've either had this done or you've watched it on telly. So yes, those sticky things on your chest, those are called electrodes on your chest, on your arms, and on your legs. And these pick up electrical signals from your heart that display on the screen or are printed on paper. Also, I forgot to mention that not all abnormal heart rhythms can be shocked in an attempt to restore a normal heart rhythm. Please understand that. Not all heart rhythms can be shocked in an attempt to restore a normal heart rhythm. And as I conclude, I remind you that acting quickly and effectively can make all the difference in saving a person's life. Thank you very much for your attention and your time.
Okay, thank you. So just as Betty is highlighting, cardiac arrest is when the heart stops beating. She's been very precise in telling us the factors that might make the heart to stop beating and what happens when the heart is no longer able to beat because it won't be able to perform its basic functions. So now we can move on to Joel. We are going to discuss the difference between cardiac arrest and heart attack because these terms are used interchangeably. And Millicent Serem, we've noted your question. I think that shall be addressed towards the end. But for now, we can have Joel coming in to tell us something about cardiac arrest and heart attack. So, Joel, which one would you like to talk to us about first? Joel, if you're in. Eugene?
I'll begin with cardiac arrest, then I believe you'll handle heart attack as you had agreed. Yeah. Yes, I'm saying, can you get me?
Yeah, please go ahead.
Hello?
Yes, sir, we can hear you.
Can you get me?
Please go ahead. Yes, we can. Please go ahead.
Hello?
Yes, we can hear you. I believe everyone is able to hear you. Please go ahead.
Okay, sorry, I think I lost some internet a little bit. I'll begin with cardiac arrest, then I believe you'll emphasize on the heart attack. So as one of us had told us, the cardiac arrest is actually used interchangeably with a heart attack. But then cardiac arrest, this occurs when now the heart will actually stop beating. Why? Because this stoppage is actually triggered by the electrical malfunctioning that will now cause the heart to have the irregular beats, what you call the arrhythmias. Now, under normal circumstances, we'll always have the normal electrical conduction of the heart. We'll have, of course, the impulse generating from the sinoatrial node, then it will transfer into the atrioventricular node, and now it goes into the bundle of his into the ventricles and supply the entire heart. But now when you have a cardiac arrest, there's an obstruction in this electrical transmission within the heart. And now this is what leads to the heart stopping to beat. And now eventually, if you're not going to manage this cardiac arrest, we are likely to lose our patient. That is why it is very important that we learn on how we are going to handle our clients or our victims with good understanding of the heart attack and the cardiac arrest. Because heart attack, if not managed promptly, it is now going to lead to what you call a cardiac arrest. Now to look at the differences on cardiac arrest, the heart will malfunction and it will stop beating unexpectedly. Then it will be triggered by an electrical malfunctioning, which causes an irregular heartbeat, as I had said earlier. And our client or our victim is likely to be unresponsive when you do an AVPU, that is an assessment. We'll see our client will be unresponsive, then the client will be gasping. And if you're not going to manage this promptly, then automatically this patient will die. And that is why it is very important that I'm glad the members who are with us, they have joined. And by the end of this session, we're going to save the lives of these victims promptly. And in conclusion, if a cardiac arrest is occurring to a patient, what are we going to do? First, we should note that cardiac arrest can be reversed in some victims if it is treated within a few minutes, that is very promptly. If you're going to manage it promptly, then we'll have our client alive. But if you're going to delay, then we are going to lose the client. So the first thing we are supposed to do, we will see the local numbers that will be displayed on the screen towards the end of the session, the emergency number. That's what you're supposed to do. First, you call the emergency number, the local from your country. If it's in Kenya, we are going to see if it's in Zambia, and so on. Then you start a CPR immediately. And then in the event you have two people, one can begin the CPR, that is cardiopulmonary resuscitation, and the other one will call an emergency number, and also can find an AD, automated external defibrillator, if it's available. And
Right.
if you're going to do that, then I believe we're going to save the lives of this client. Then finally, we are going to see more information. The link will be provided.
Right. So thank you so much. So a quick rejoinder on that, the differences between heart attack and cardiac arrest. For heart attack, what you have to remember, just as Gina said, is this is a circulation problem. So there are blood vessels within the heart which supply the heart itself with blood. So think of the blood vessels as pipes, and these pipes are containing something that is going to keep that area that they are being connected to alive. So think of blood flowing from point A to point B, still within the heart. And then this blood flowing within the pipes becomes obstructed. So there is a blockage. So either there is a clot or there is something that is causing blood from point A within the heart not to get to point B. Now, if that happens, point B will die off because it will not be receiving the oxygen that is needed to keep it alive. It will not be receiving the nutrients that are being transported in the blood that are needed to keep them alive. So what happens then? Someone suffers a heart attack. And in a heart attack, that part of the heart begins dying simply because it's not been receiving oxygenated blood the way it is supposed to be. But now in cardiac arrest, just as Betty had told us, it is a rhythm problem. And this rhythm is what makes your heart contract and relax. So this is what leads to pumping of the heart. So that means if there is a flat line, for example, as she had started to explain, then there is basically no contracting, there is no relaxation of the heart, so your heart is not pumping blood the way it is supposed to be. So these two factors have to work together. And as the presenter said, cardiac arrest is going to be caused by a heart attack. But in other situations, cardiac arrest might occur on its own, and that becomes sudden cardiac arrest. So hoping we are still following. I think I had lost my screen share for a moment, but we should be back now. So confirm you're able to see my screen. So a heart attack might cause a cardiac arrest. But if all these situations are handled in good time, there is recognition in good time that this person is having a heart attack, there is something that can be done. If there is recognition that this person has gone into cardiac arrest again, there is much that can be done. And we have different heart attack symptoms for men and women. I think this is something that needs to be well clarified, that we might be having different signs and symptoms for men and different signs and symptoms for women during a heart attack. And this is basically what needs to happen. For men, you might encounter challenges or complaints of nausea. Nausea is whereby someone feels like vomiting, or there might be actual vomiting. So feeling like vomiting or the actual vomiting. There might be jaw, that is specifically the lower jaw, the neck, or there might be some pain towards the back. And there might also be squeezing chest pressure or pain. So with this pain, it is not a sharp chest pain, but it's usually a dull pressure-like chest pain. We have a patient who says that they felt as if they had something heavy being placed on their chest. So that's how the pain feels like. And for women, the first thing you notice is that the symptoms are quite more than in the men. And we have nausea or vomiting being a repeated symptom. We have jaw, neck, or upper back pain. We have chest pain, but not all the time. So a woman might be experiencing a heart attack, but will not have the characteristic chest pain associated with a heart attack. Now, what they might experience instead is pressure or pain, which is in the epigastrium. The epigastrium is just below where your ribs join and just above your navel. So that upper abdominal area. And they might also be experiencing breathing difficulties or shortness of breath. They might feel faint. Some of them might actually even faint. And some people even confuse it with symptoms of indigestion. So they assume that probably they ate some food that was not well prepared, and they might also experience extreme fatigue. So those are the different signs and symptoms that you might experience in a woman and in a man who is having chest pain, which you could suspect is probably a heart attack. Because remember, not all chest pain is going to be a heart attack. Chest pain could indicate an issue with your lungs. Chest pain could also indicate an issue with your ribs. So you need to have a proper idea of the signs and symptoms which could specifically be related to a heart attack. Now, moving on, I will invite Mr. Dennis Monakanyamba from Zambia. Dennis is an ALS paramedic with the Ministry of Health in Zambia. So I believe he would be best positioned to tell us about how to call for an ambulance in an emergency. And then we can quickly look at the different emergency numbers in the different countries. If you have a question, of course, please remember to drop it on the chat and we will address it towards the end of the session. So, Mr. Dennis, if you are on, please unmute and go ahead.
All right, thank you. Mr. Williams, my role would just to highlight.
Sorry, Dennis, you're breaking. I don't know if it is on my end only. You're audible, but your network seems to be having a challenge.
It's still not clear, even now?
Much better now, much better.
Much better? All right, so to run you quickly, when we have an emergency, for example, someone collapses, and we have identified that this is an emergency that would need an ambulance on scene, most definitely we have to call the ambulance. So for each and every country, I believe we have different emergency care systems that are running currently, and we have different organizations, could be private organizations or the government that could be taking the lead in terms of calling or offering emergency care services. So for Kenya, most definitely have to call the numbers that have been highlighted. So we have the Zambia we have the Red Cross that offers emergency care services in Kenya, and a company that is E+. So you can call them through the number which is 1508 or 0700395395. That's their emergency line for an ambulance. That's for Red Cross Kenya. And then you can also call for an ambulance using the rescue line, which is 0711 911 911. And then we also have St. John's Ambulance, that is right there in Kenya, which can be accessed to the number 072 122 5285. So I believe these numbers will be shared at the end of the presentation, but I'll definitely just run through us the numbers. So when we call the ambulance, first and foremost, we have to be very critical about two things. Number one, it is where you're calling from. And then number two, why you're calling. And you have to give extra details. For example, you have to give what's happening so that as the people are coming on scene, they also know what to carry and what extra things they'll need to be able to use when they come to attend to that emergency. So moving forward for Nigeria, the Emergency Response Africa line, which is toll-free, is 0800 2255 372. That is the toll-free line. And then also in Nigeria, we have the Nigerian Red Cross Society, which also offers emergency care services. And then there's a number that has been attached to their society. So like I mentioned, these numbers are quite long. So if I was going to mention them right here and then, some of us will definitely forget. But at the end of the presentation, like Mr. William has said, these slides will be definitely shared, or this presentation is definitely being recorded. So lastly, or in conclusion, we should always remember that as we are making the phone calls to these ambulance services, we must always be calm and relaxed so that as they're asking questions to us, we may also provide the necessary information that will help the people that are going to come on scene to provide or to carry and provide the right and necessary care. I submit, Mr. William.
Thank you so much, sir. I think that was very well elaborate, and of course, thank you for the wonderful work you're doing in your side of the continent. I don't know if we have Meme. Meme is Meme is our country representative, the African First Aid Council representative in Nigeria. Meme, I don't know if you're able to join us for this session. I think you could be the best person to confirm if the emergency numbers provided, especially for the Emergency Response Africa, are the accurate ones, or if we need to have different contacts. But in case there is any input, please feel free to let us know in the chat. Now, building up on what Mr. Dennis has said, stay on the phone, do not hang up until the dispatcher tells you to hang up. And answering the questions which the dispatcher is asking does not mean that they are not getting you help. I've seen, I think, 2 or 3 dispatchers here in this forum, and they can guarantee you that we have multiple systems of communication, having been a dispatcher myself, whereby you can get information from the caller while at the same time still dispatching an ambulance. So don't get pissed off when the dispatcher is asking you follow-up questions and getting worried that they are not getting help to you fast enough. The ambulance could be on its way, and you giving more info will help you get better help and better chances of survival. Now, I'd like to invite Ms. Grace. Ms. Grace, you can take us through what to do as we wait for help, because following the format of this webinar, we started by looking at what cardiac arrest is, sudden cardiac arrest. We looked at what heart attack is. So we've been able to look at the recognizing somebody who has gone into sudden cardiac arrest. They are unconscious, no breathing, they do not have a pulse. We've talked about somebody who is in a heart attack. They are having severe chest squeezing or chest pressure, chest pain, maybe symptoms of indigestion. They are having some nausea, vomiting, and you clearly know that this person is having symptoms of a heart attack. As we are getting help, and waiting for help to arrive. First aid can save these people's lives, and that is what Ms. Grace is going to get us started on. And for the first segment, we will look at what to do if someone has gone into sudden cardiac arrest, and then we will now move on to what to do if someone is experiencing chest pain or symptoms which you suspect could be due to a heart attack. So, Grace, if you're in, please go ahead.
Thank you, Mr. William. Hi, everybody. Thank you for staying on the call. Okay, so I want to confirm, can we all hear me? Can we hear me, please? I just need a feedback, so I'll continue.
Yep. We can hear you.
Okay.
Please go ahead.
Thank you. Okay, thank you. So, what do we do when we're waiting for help? Just like the other panelists mentioned, that you continue to dial the ambulance and wait for help from the ambulance. So even as you're waiting for help from the ambulance, there's something that you as a bystander can do to help the victim. Okay, so and that is what we call CPR. CPR is cardiopulmonary resuscitation. Cardio means the heart, the area of the heart. The pulmonary is associated with the lungs, and resuscitation means bringing back to life. So this means that you are helping the victim to pump blood back to vital organs. The victim is already in cardiac arrest. The victim is already in cardiac arrest, which means the victim's blood might not be getting to the vital organs where it is needed. So CPR is you helping the victim to pump blood to vital. You all know how important the brain is to the body. So CPR means you are helping the victim to pump blood to vital organs such as the brain. Okay, so you begin CPR if someone is unconscious and not breathing. Once you notice that, okay, this person is unconscious and this person is not breathing, then you begin CPR. So that means there are certain situations that you really don't need to do CPR. You just have to confirm if the person is unconscious and if the person is not breathing. So, and the recommended type of CPR to use is hands-only CPR. So this is the CPR that you perform without mouth-to-mouth breath. So you call an ambulance and you push your hand, you push hard and fast in the center of the chest. There'll be a video for us to watch after this session, so we would actually understand the hand placement and how fast the CPR is going to be. So hands-only CPR is the CPR that you do without mouth-to-mouth breath, and that is the highly recommended CPR for adults and teens that suddenly collapse. Okay, so hands-only CPR can help teens and adults who suddenly collapse without and stop breathing. So when you notice that a teen or adult collapsed and stopped breathing, I feel like there is a reason why the stop breathing is continually emphasized, right? Because you are helping the person, because the person is not breathing, the person is not able to pump blood, the heart has stopped breathing, the person is unable to pump blood. So you are helping, giving first aid with hands-only CPR. So, and it can make a lot of difference. It can make a lot of difference even while waiting for the ambulance to get there. It can make a lot of difference, and yes, it saves lives. It saves lives. Yeah, so there'll be a video to watch immediately after this, because there is a rate at which you have to compress the chest. There is a rate of compression of the chest. There are specific hand placements. You are not just going to put your hand on the chest and keep pressing without actually giving the right first aid. So there is a method of compression that goes per minute. Yeah. And there's a type of number of compressions that goes per minute. Yeah, so would watch the video now so that would completely get and understand what CPR is. Mr. William, can you connect us to the video?
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call your local emergency response number or call it yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest, then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push, giving 100 to 120 compressions per minute, which is about the same tempo as this song. Let's hope you never have to use hands-only CPR. But if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call your local emergency number, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. To learn more, visit international.heart.org.
Thank you so much, Mr. William. Okay, so from the video that we've just watched, we can see that there is no mouth-to-mouth breath even in that video. So we're just encouraging that you can always perform hands-only CPR for victims who go under cardiac arrest. And the compression, just as it was stated in the video, is 100 to 120 compressions per minute. And it is also important to note that you are not expected to stop unless you have another person to help, or the ambulance arrives, or the person gets better, recovers, right? Okay, so yeah, I believe that's all. Right. Thank you, everyone.
Thank you so much, Ms. Grace. And there's a question from Dorothy Nyabuto as we are winding up. Dorothy is asking how deep to go. Now, the current recommendations by the American Heart Association recommend 5 to 6 centimeters, that is 2 to 3 inches. You're very welcome to correct me in case I might be misspeaking, but 5 to 6 for adults. Now, the issue becomes you do not really have a way to measure. So we recommend just follow the guidelines whereby you have proper hands placement, use the strength from your shoulders, not from the lower part of your hands. So basically, you are leaning on the patient and pushing hard and fast. Research has shown that more people tend to apply less force during the CPR, which then becomes ineffective. So few people really use too much force that would cause damage or cause breakage to the ribs. We're not saying it happens, it doesn't happen. It happens, yes, but the chances of it happening are lower because more people use less force. The best way, and I think what I've always used as a gauge myself, is to attend as many practical CPR sessions as possible. The training equipment that we have, the CPR mannequins and the likes, have been modified to give you a specific feedback when you're going at the correct depth and also when you're going at the correct rate or speed. So through attending multiple basic life support classes, multiple first aid classes, you're able to then now have a better idea of how these would translate to an actual human being. But what you need to remember, I think we might not have mentioned this, is before you start giving CPR, the person needs to be on a flat, firm surface. So if this person was on, let's say, on the bed, on a mattress, then you have to lower them to the floor. In the hospitals, you might have observed that they usually have a flat metal board, which is usually in the resuscitation cart or the resuscitation tray. So if somebody has gone into arrest, cardiac arrest, and they need to be resuscitated, we usually place this board beneath the patient's back. But because you do not have this modification at home, then if somebody was in the mattress, you have to lower them to the floor because CPR should be done on a flat, firm surface. And thank you so much. I see Aunt Tracy is really emphasizing that, so thank you so much for that. Yeah, so we can take questions now as we come to the end of this session. We can take any questions that we have. I'm trying to check the chat. I'm not seeing any other. Ruth is asking, how about a scenario where a casualty with fluids? What do we do? So if somebody is producing maybe foam, they are frothing from the mouth while in cardiac arrest or while unresponsive, or in case they are vomiting, then you need to tilt the head to the side. So for those who have been in first aid classes, we talk about the recovery position, but now this won't be like a full 180 degrees turn recovery position. You can just try to move the person as a unit, try to move them as a log rolling basically, because you don't know if they have sustained injuries to the head, neck, back or spine, but just try to turn the head towards the side so that they do not choke on their own vomit or on whatever is likely obstructing the airway. There's also a question from Dorothy. Why are symptoms more in more in women than in men? I think that is for a heart attack. And yeah, who are more prone to heart conditions, men or women? So any of the panelists would like to answer that, you can please have your hand up, and then we can allow you to unmute so that you can give feedback. So the question is in two parts. Part one is asking, why are the symptoms more in women than in men? That is for a heart attack. Why do women have a broad range of symptoms as compared to men? And part two of this question is, who are more prone to heart conditions? Is it men? Is it women? And I can also see a lot of instructors on this call. Please feel free. You can unmute and speak. I can also see healthcare providers. I don't want to mention by name, but you can please feel free to contribute to the conversation. So anyone to answer Dorothy's question? And as we look for an answer, there are people who wonder if they can get in trouble for helping. So someone might ask, if I start performing CPR, can I be sued? And the simple question is that there are Good Samaritan laws which exist to protect care providers, specifically out of the hospital, while giving assistance in good faith. Now, in Kenya, where I'm from, the law is not well pronounced. We have the First Aid Regulation Rules 2023, but these focus more on workplaces than on general first aid and the legal consequences that go along with it. But what we can say is you give help in good faith and documentation plays a very big part, because through your documentation you are able to know at what time did you provide care to this casualty, what were they complaining of, how did you assist them, and basically we have a clearer image of the level of care that was provided, because you're not licensed as a healthcare provider. We are not going to hold it against you that this should have been perfect and this person should not have been died. So long as you did everything to the best of your ability and you did not overstep your authority, you did not start giving injections and the like, then you should be good. Another person might also ask, what if you do the wrong thing? What if you do CPR wrong? And there's this common saying, I think I've had it for some time now, that bad CPR is, I don't know, something, shouldn't, something. Bad CPR is better than no CPR. And I agree, because what's the worst that could happen? If you hadn't given this person help and they were in cardiac arrest, they become brain dead and resuscitation is not possible beyond that point. So the best chance of survival that you can give someone, the best thing you can do to give them a chance at fighting for their life is simply starting hands-only CPR. So even if you just watched a short video, even if you watched a TikTok reel or just a short clip on Instagram, whatever it is, you start CPR and call for help. Majority of the dispatch centers are staffed by medics who give you pre-arrival instructions. So they will tell you what to do or how to compress as you wait for help to arrive. Another common question that I get in my sessions is, can I make it worse? So what if someone has an injury? Is it going to make it worse? And a response that has always been given is, you'd rather have someone who is alive with a broken bone than someone who's dead, yet there is something that you could have done. So no, you cannot make it worse. CPR is the end, cardiac arrest is the end point. It is basically the last thing before you die. So do what you can, even if you have little training, just try your best to give assistance. So a person whose heart has stopped must receive CPR to survive. It is not about how close you are to the facility. It is not about how good your insurance cover is. If nobody close to you knows how to push hard and fast at the center of the chest in case of sudden cardiac arrest, then you're as good as gone. Now, remember, the life you save may be that of a loved one. And what I mean by that is, generally in Africa, CPR is not widely. So Africans are... someone is unmuted. David, please mute. Done. So, as I was saying, Africans are less likely to receive bystander CPR because most people assume that once somebody has stopped breathing, or even in some cases, people don't check for breathing. They just assume that if somebody is unconscious, then they are dead, which is very, very wrong. Start CPR as soon as you can. And remember, cardiac arrest can happen to anyone, even athletes, even very fit people, even very young people. It is not something that is affecting the old. It is not something that is affecting people who are of a specific ethnicity. This is something that affects everyone, and every person should strive to know CPR, because you never know who it might happen to. Kelvin Chalo, I see your hand is up. Please drop your question on the chat, and then we can address it. So remember, don't feel helpless, guys. If someone has become unresponsive and they are not breathing, simply start hands-only CPR. Send somebody to call for an ambulance. If you're alone, get your phone, dial the emergency number, put it on speaker, and then start pushing hard and fast at the center of the chest. And that is basically it. If you suspect someone is having an heart attack, they're displaying symptoms of an heart attack. They're telling you they're complaining of severe chest pain. They're giving symptoms of nausea. They tell you they feel like vomiting. In some cases, they may vomit. In females, you might have cases of indigestion. Then check their medication. If this person has been going for regular checkups, chances are they will already have been prescribed a blood thinner by their doctor. Now, this could be aspirin, things like Ascard. Give them that Ascard to chew as they wait to go to the hospital. That buys them some time. And if you do not have this medication or you are unsure, please call for an ambulance immediately. Ambulances are well staffed by emergency medical technicians, by paramedics. So they have the medical know-how of what they can do as they get you to your hospital or as they get you to the next best level of care. And I think that's it from our end. Ruth is asking.
I'm sorry, William, I'm sorry. May I take less than 30 seconds to answer Millicent Serem's question? Hello, can you hear me?
Please go ahead.
Yes, so Ruth Serem, where is that? She asked, which types of abnormal heart rhythms can't be shocked? Ruth, you remember I mentioned, I apologize if I was fast, but you remember I mentioned a rhythm called asystole. So as in asystole, there is no electrical activity in the heart and there is no pumping activity, right? So we call that, you might have seen it on telly, flatline, where you see a flat line on the monitor. That is asystole. The other rhythm is PEA, called pulseless electrical activity. And in PEA, you will see a very nice organized rhythm on the monitor. It looks like your patient is alive, but when you go to check the patient, when you check for a pulse, carotid pulse near the neck, where the neck, on the side of the neck, you will find that this patient has no pulse. So it's basically those two, PEA and asystole. I really hope I have answered your question. Thank you.
Right, so Ruth the Dust, so I think that was in response to Millicent Serem's question. Ruth had asked, in the process of performing CPR and you notice fluid even after performing your primary assessment, you have said I have to log roll the casualty, but at the process I am also interfering with CPR. Now, what we'll say is you cannot perform CPR if fluids are coming from the mouth, in the same way that you cannot perform CPR if a vehicle. I think we need to mute someone, Miriam. If a vehicle is moving. So yes, you'll have to stop CPR, log roll so that the fluids can come out, then continue, because you do not have an active suctioning, suctioning equipment. So you cannot perform CPR while at the same time doing the suctioning. You have to tilt for some time and then continue with CPR. The recommendation is do not interrupt CPR for more than 10 seconds. So if interruptions are going to be there, let them be less than 10 seconds. Flora, thank you for joining. Flora says the patient is diabetic. The mom has a stroke and has high blood pressure. She's weak. And in case she collapses at home, can you give chest compressions? Yes, yes, yes. Anybody who has collapsed at home, they are unconscious, they are not breathing, please start CPR. And I'll make it easier for you. Don't even check for a pulse. If somebody is unconscious, you're at home, someone is unconscious and they're not breathing, start CPR immediately. If you've been trained to check for a pulse, well and good. But the problem becomes if they have a pulse and they're not breathing as a bystander, what do? You'll still have to perform hands-only CPR because you cannot give mouth to mouth. Mouth to mouth needs a bit of training, number one. Mouth to mouth needs a protective barrier. So mouth to mouth is out in the out of hospital setup. Very few people have the pocket masks to provide a barrier. So in essence, mouth to mouth is out. If somebody is unconscious, they are not breathing, push hard and fast at the center of the chest, wait for help to arrive. In most cases, you might not even feel for a pulse, all right? If you have not been trained on how to check for it properly. So just unconscious, no breathing, start CPR. And how to check for breathing is you listen to the breathing sounds. You can be able to hear somebody breathing if you listen closely. So you might need to bring your ear close to their mouth. Number two, look at the rise and fall of the chest. When air gets into the abdomen, into the breathing system, the chest rises. When it gets out, the chest falls. So if there is rise and fall of the chest, then that means this person is breathing. If there isn't, or you're unsure, start CPR immediately. So, Flora, I think we've answered your question. So in case they collapse, you'll just lower them to the ground and start CPR. Ruth asks, I have a suggestion or a consideration on how to handle a patient with electrocution, since the movement increases the chances of having cardiac arrest is high, and maybe depends with the voltage. All right, Ruth, if I understand your question, you're asking about someone who has gone into cardiac arrest due to electric execution or electrocution, or let's just call it an electrical injury without going too much into the details. Oh. So what's happening? MK. So for electrical injuries, safety is key. Safety is the most important bit. So if someone has been in contact with the faulty electric system and they have suffered an electrical injury, the first thing always is to switch it off, switch off that power from the main switch. So if you will find the security officer responsible for that building or anyone who can be able to tell you where the main switch is or the switch that is supplying electricity to that specific area is, switch it off. And then you'll need to wear something that has poor conductivity with electricity. So maybe shoes which have rubber soles or something like that. Basically something that is not a good conductor of electricity. You can use plastic, you can use a piece of wood to detach the person from whatever appliance or equipment or wire has caused that injury to them. And then you can now move forward with assessment, check if they are breathing. If they are not breathing, immediately start CPR. Good. If there are any questions, please go ahead. Flora, I won't read your last message, especially towards the end. We don't really want to get into these conversations. But for emergency numbers in Oman, I think I can try checking. But if there's anyone who has a direct emergency contact in Oman, please feel free to post them in the chat. Meanwhile, anyone has a question, as we look for the answer to Dorothy's question. Dorothy had asked, why are symptoms more in women than in men? So anyone can have their hand up and give us some feedback. What do you think? Why do you think the symptoms are more in men than in women? Anyone? Anyone? Yes, please go ahead. Someone is unmuted.
Hi everybody. I don't know if I'm audible enough.
Yes, Millicent, you are. Please go ahead.
Okay. I don't have an exact explanation as to why, but I think it's because of the different biological features between men and women. But I still don't get an exact reason why women have more symptoms of heart attack than men. But it has to be something related with our physique and theirs.
Right. Thank you so much, Millicent. And I don't see any other feedback coming in. I wouldn't say we've been able, even from the research, to pinpoint a very clear reason as to why. But the most recent evidence is basing it on not really the physique, but on the structure of the blood vessels. So they say that for women, they generally have their blood vessels are more narrowed, and this causes the heart to pump slightly differently. And even as they age, as they get to the mid peak years, so 40, 45 plus, then the heart is also pumping slightly differently. I might not really have brought it out in the most comprehensive way, but I can just summarize it as women having generally smaller heart. That is generally, of course, there are exceptions to the rule. So generally having smaller heart in terms of sizes and slightly narrower blood vessels as compared to men. So this leads to the difference in the symptoms. But again, I am very open to hearing a different explanation or a clearer point of view, but that's how I would classify them. Good. If there's no other question, I think we can just have Mr. Hans. Mr. Hans is the Chief Executive and the founder at Universal Care for Africa Foundation. So Hans, as we wrap up, in less than 30 seconds, please say something if you're on.
Okay. Thank you so much, William and everybody. I just wanted to say thank you for putting on this webinar. It was very educative. I got an opportunity to learn a lot, and I appreciate everything that you guys are doing. Just a little bit about our organization. We are a nonprofit organization that works with underprivileged communities in Africa. So I want to encourage us to all come together and work with and see how we can help to improve the healthcare system in Africa. Thank you again, William, and thank you to all the presenters. Thank you so much.
Thank you so much, Hans. Universal Care for Africa Foundation is a partner of ours, and they are enabling these discussion sessions to happen at least once every week. So we are super grateful to them. Isa, if you're on, Isa Atman. Isa, anything? Daniel, anything? I can see you guys are on. Jedida or Fula as well, you can please say something. Right, so there's a question from Flora. Flora is asking which gender, sorry, I think it's Millicent, sorry, Serem. So Millicent is asking which gender is more likely or more prone to heart issues, and I would say males. But the thing is, males are more prone, yes, to the cardiac issues, but their survival rate is slightly higher than for females. So females are less prone, but they have a high fatality rate as far as the data shows. So Jade, if you're on, anything? All right, okay, right. So I think that's fine. Thank you so much to everyone who has been able to join. I hope we have answered all your questions. I hope the session has been productive, and I really hope this has been a good use of your 1 hour. We do this every month. So next month we'll have another webinar on another topic. So feel free, you can always give us feedback on what you would want us to talk about next. If you want us to discuss stroke, we can do it. If you want us to talk about seizures, epilepsy, and convulsions, we can talk about it. If you want us to talk burns, asthma, bee stings, snake bites, you let us know, and we'll always be willing to have these discussions. You can follow us on our social media platforms. If you've not joined the WhatsApp group, you can do that. And if you're ever taking a stroll in Nairobi, you can also visit us at First Parklands Avenue, and we can keep having these discussions. So thank you so much, everyone. Thank you to the Vital Signs team for helping us with the sign language interpretation. So Kevin Chalo and Tracy Njoki, Jedida, and Alice, the whole team, we are really grateful to you. And we hope to have you guys on the next webinar. So thank you so much and enjoy your Wednesday evening.